Hi everyone, my name is Maria and welcome back to the channel. The mental health profession is currently navigating an unprecedented surge in demand.
I'm a little busy.
While the primary focus of a clinician remains patient care, the logistical reality of a modern practice involves a significant and often overwhelming administrative burden. Data from MindMoneyBalance indicates that caseloads for mental health professionals now frequently reach 30 to 40 clients per week, with some clinical environments managing several hundred. This volume creates a high-risk environment for clinician burnout and compassion fatigue. However, the exhaustion faced by providers is not solely a result of clinical hours. It is compounded by the systemic requirements of private practice management. According to the Teletherapist Network, a standard 40-hour work week for therapists seeing 30 clients typically necessitates 10 full hours of administrative labor. This represents about 25% allocation on professional time towards non-clinical tasks, most notably medical billing and revenue collection. Today, we will talk about how optimizing the invoicing process can mitigate this administrative strain and enhance the sustainability of your practice. To help you get started with that optimization, we have created 6 comprehensive therapist invoice templates that you can download right now by clicking the link in the description. Now back to the video. In 2019, nearly 20% of American adults were utilizing mental health services. Since 2020, those figures have escalated dramatically. Research indicates that 74% of psychologists have reported an increase in clients presenting with anxiety disorders, while 60% report a rise in depressive disorders. Furthermore, the industry is currently facing a critical shortage of over 6,000 providers nationwide. As caseloads expand to meet this demand, the administrative workload scales upward too. For the independent practitioner, managing more than 30 patients per week results in a steep increase in time dedicated to medical coding and insurance claims. The primary objective of an effective invoice is the clear communication of financial responsibility. A cluttered or overly complex document is counterproductive. When a patient receives a statement that is difficult to navigate, it creates a point of friction that often leads to payment delays or an increase in administrative inquiries. If a client must contact your office to clarify their balance or payment options, your total administrative hours increase. By utilizing a simple streamlined template that emphasizes only essential information, such as the date of service, account number, and the total amount due, you facilitate a faster transaction. This simplicity reduces the cognitive load on the patient and minimizes the time you spend on manual follow-up. In a therapeutic context, design should be an extension of care. Financial transactions are a known source of stress. Statistics show that 72% of Americans experience significant anxiety regarding their finances. For a patient already seeking treatment for mental health concerns, an aggressive or poorly designed invoice can exacerbate symptoms. Strategic design choices can mitigate this. Utilizing color palettes featuring green, blue, or purple tints can foster a sense of calm and professional reliability. If color printing is not feasible, the use of white space and clear visual hierarchy is essential. By organizing information logically and using clean typography, you ensure that the patient can find key details, such as contact information and payment terms, without unnecessary frustration. Modern invoicing should serve as a dynamic communication tool. Rather than a static document, your invoice can incorporate dynamic messages tailored to the patient's status. Placing these messages at the top of the statement ensures they are the first items read. These messages can serve as professional reminders for past due balances or provide updates on practice policies. The invoice is an ideal touchpoint for session management. By integrating a prompt or digital link for scheduling the next appointment directly onto the invoice, you encourage consistent care and reduce the need for separate scheduling outreach. Efficiency in modern practice is often determined by the adoption of digital tools. Integrating QR codes, for example, into your billing statements allows patients to access secure online payment portals instantly. This technology automates the collection process, provides immediate reimbursement, and offers the patient a convenient professional experience. By directing patients to a portal where they can manage their own payments and scheduling, you effectively decentralize administrative tasks. Addressing the burnout epidemic in the mental health field requires a multifaceted approach. While clinical demands are high, the administrative burden is a variable that providers can actively control. Implementing professional, streamlined invoicing is a practical step toward protecting your professional longevity and improving the patient experience. If you'd like to learn more about streamlining your revenue cycle, reach out to eTactics. And you already made it this far into the video, so you might as well like it, share it, and comment below.